Good morning. I'm Dr. Robert, and my topic this morning on this edition of 5-ish Minutes with Dr. Robert is Ayurveda and homeopathy. In certain ways, Ayurveda is a very different medical system than homeopathy. They are both useful medical systems. Let me emphasize that I myself take homeopathic medicine periodically, and I encourage other people periodically to take homeopathic medicine. But I think it's useful to try to understand how the two systems are similar and how they are different. Ayurveda is overall a system that focuses on the health and well-being of the organism. It is certainly a method for treating individuals, but the methodologies of treatment are less important than the darshana, the philosophy of understanding how the organism works and how to keep the organism in harmony with its environment. So, from one point of view, and this is a point of view that I espouse, the treatment methodologies are less important than the way of understanding, and working with the patient. And other Ayurvedists have this feeling as well. For example, when I first went to the Tilak Ayurved Mahavidyalaya in Pune and began my course of study, the principal of the college was Dr. Vardalkar, and he was a well-educated and eminent Ayurvedist, but in his private practice, he only administered homeopathic medicine. So he felt that there was no difficulty in employing a treatment modality that was not officially regarded in or delineated in the Ayurvedic texts. Ayurveda has always appreciated the homeopathic approach to treatment. The basic principle of Ayurveda is an allopathic approach. Allo means other. So the basic principle of Ayurveda is if the disease is a hot disease, apply cold remedies. If the patient is heavy, lighten them up. If there is dryness, then that dryness needs to be addressed by things that are wet, not necessarily water, oil usually. So the allopathic approach is, let's say, roughly 90% of Ayurvedic treatment. But the other 10% is what we call tadarthakari chikitsa. That means doing something that is the same as the cause or the symptom, or the cause and the symptom of the disturbance. For example, if a person has a lot of kapha and the ordinary methods of reducing kapha have not benefited the patient appropriately, we might give them a large bolus of molasses and salt and yogurt for them to consume, which will cause all the kapha in the body to immediately proceed to the stomach, where it will make the patient hopefully very, very nauseated, so that it will be easy for vomiting to occur and the kapha to be thrown out of the body. Or sometimes a person has a very chronic and resistant to treatment vata disturbance, and sometimes the best way to deal with that vata disturbance is to administer a shock. Normally a shock would aggravate vata, but sometimes in the right way a shock may encourage vata to be released, and therefore thereafter the individual may be able to get the prana to start circulating again properly. And this is the principle of homeopathy, where there is a disturbance in the body. Determine the nature of that disturbance, determine what sort of substance might be able to replicate that aggravation in the person, and by giving that in a particular potency, encourage the body to react against it and come back into balance. Of course, with homeopathy, the most important things are to find the precise remedy and the exact potency that are necessary. So it is not something that you can simply do without any knowledge whatsoever, as some people believe nowadays. It is also a very abstruse kind of science that should be studied practically and in detail in order to make best use of it. But in my opinion, at least, Ayurveda and homeopathy can work together in a positive way. And my hope is that this will be the case in the future. This is Dr. Robert wishing everyone success at treatment.